Hi, I'm Dr. Gil Milmed. I direct the clinical services at the F. Wajaja Foundation Inflammatory Bowel and Immunobiology Research Institute. I'd like to spend a few minutes discussing with you some of our clinical programs, particularly highlighting our clinical research, our clinical IBD education, as well as some innovative models of care delivery we are piloting at our IBD center. Inflammatory bowel disease is a chronic illness. Currently, there are limited therapies available for both Crohn's disease and ulcerative colitis. There's also a need for specialists to treat complex inflammatory bowel disease. Because of the lifelong nature of the condition, patients who suffer from inflammatory bowel disease have to deal with complications that may relate to the disease or ways that we treat the disease. At Cedars-Sinai Medical Center, we have a large volume of patients with inflammatory bowel disease, last year with over 3,500 visits. And in addition, our clinical program is able to interact in a 360-degree perspective with our very large research enterprise on a basic and translational nature. So what is our mission here at Cedars-Sinai Medical Center with respect to our clinical IBD program? We aim to provide outstanding, high-quality clinical care in 3 areas. Number 1, in inflammatory bowel disease clinical research. We have an active program with multiple clinical trials evaluating new treatments for inflammatory bowel disease, as well as several clinical research programs and projects that are going on that address important clinical questions directly relevant to patients and patient care. We have an emphasis on IBD education. And finally, in addition to our large clinical volume with the traditional model of care delivery, where one patient comes in to see one doctor, we are also exploring innovative ways to deliver patient care to maximize the experience and the expertise we have available. So why do we do clinical research in inflammatory bowel disease? Hopefully, we can ultimately learn about risk factors that can help us identify bad outcomes before they occur. We want to be able to test competing management strategies and new therapies. We want to be involved in the design of clinical trials that can directly impact clinical outcomes and clinical practice and change the way doctors treat patients with IBD. And to also provide substrate for the clinical and translational research enterprise, and to help us identify new targets for therapies that can ultimately help cure these diseases. We have an active clinical trials unit, which has been involved over the last few years in the development of multiple agents that are on the horizon for being approved for treatment in inflammatory bowel disease. In addition to participation in these trials, for many of them we've taken an active leading role in the design of these trials to optimize the chance of success in the treatment of inflammatory bowel disease. In addition to clinical research, we have a strong emphasis on the education. We currently educate 2 to 3 advanced IBD fellows a year. These are fully trained gastroenterologists who come and spend a year with us. Finally, we have an emphasis on patient education, and several of our physicians participate on multiple patient education conferences, as well as help lead local patient education events. And finally, our active patient care clinic. We do see a lot of patients under the traditional care system where one patient comes in to see one doctor, but we are now exploring innovative ways to help improve the delivery of care for our patients with IBD who may have complex problems and may need to see, for example, other specialists. We are exploring the idea of multidisciplinary clinics, where one patient may come to see not only their gastroenterologist, but may also partner their gastroenterologist together with, at the same time, a specialist in another discipline. A rheumatologist, for example, for patients who suffer from joint pains. An OB/GYN specialist, particularly for women with high-risk pregnancies. Psychiatry and social work who can assist our patients who need additional help with coping and with general well-being. We are working in close partnership with colorectal surgery in order to provide a unified experience for patients who may come to see both the gastroenterologist and the colorectal surgeon at the same time and get input from both at the same time in order to avoid conflicting opinions and provide complete care at one visit. And finally, we are exploring diet and alternative therapies through one of our physicians who has a special interest in this area. A second innovative care delivery model we are also exploring is the concept where multiple patients may come and see one physician at the same time. And this is the idea of a group health maintenance visit. For many of our patients, there are health maintenance issues such as vaccinations and skin dermatology screenings for skin cancer that may allow for the opportunity for multiple patients to come and visit at the same time in order to provide maximal care to a large number of patients for issues that may be related to but not specific to an individual's particular disease, because these are ways that we can help prevent complications that have occurred or can occur in our patients treated with various therapies. So coming back to our mission in clinical inflammatory bowel disease here at Cedars-Sinai Medical Center, part of the F. Widjaja Foundation for Inflammatory Bowel Disease and Immunobiology Research, is to provide outstanding high-quality care, to deliver high-quality care in the realms of IBD clinical research with our clinical trials program and to understand important questions for our patients, to provide high-quality, outstanding IBD education to other physicians locally and nationally, as well as to our patients, and finally, to participate in the changing environment of healthcare by exploring new ways to provide high-quality care to our patients directly and thus impact their care and their quality of life. Thank you very much.